Okay, so I welcome you all to today's session and a happy Independence Day to all Nigerians. So today we're going to be talking about the true cause of heart attacks, okay, and how you can save yourself. And I would also give you some first aid practices that can help just in case you or someone in your home is suffering from a heart attack. At least you can get to the hospital alive, okay? So before I begin, I just want to say that I would never call you to inform you about these Zoom sessions. All right. I would never ever call you to inform you about these sessions. I would never send a code to you personally or ask you for a code. So please be on alert. People may be trying to use my name to hack into your WhatsApp accounts. So first off, make sure that you have your two-step verification on, because if you have your two-step verification on, WhatsApp would alert you that you should not give out your code unless you are the one that is trying to log into your WhatsApp. So that's very important. Okay. And also don't listen to anyone who would call you saying that they are from me. I don't work with anyone else. Okay. If I did, I would have introduced them to you a long time ago. All right. So let's talk about the true cause of heart attacks. Now, I found this graph about last week and it was really interesting for me. Now, there is so much conflicting information about the cause of heart disease. Okay, so much conflicting information. Today, you hear that cholesterol is the cause. Tomorrow, you hear that cholesterol is not the cause. After that, you hear that saturated fat is good. You know, there's so much conflicting information. You should go low fat. You should avoid fats, avoid oils, etc. So let's talk about the conflicting information. Let's talk about the real cause of heart disease. And most times you find out that your doctors, they focus more on LDL cholesterol in general, okay? Or just your cholesterol in general. If you go to the hospital and you are hearing about heart disease or heart attacks, the first thing that will pop into your mind is cholesterol, right? So let's talk about that as well. So this graph that you are seeing on your screen right now, it gives you the hazard ratio. And what that means is what is most likely to cause a heart disease, okay? So the very first graph, the very first thing we see on our graph, the very first marker that we see on our graph is type 2 diabetes mellitus. Okay, and it has a 10.71 mark. That is a very, very huge score. A very huge score. It's as big as when we tell people don't smoke. Smoking is going to cause lung cancer. You know how big smoking can affect your lungs, right? It is this big. Diabetes causing heart disease. Heart disease is one of the major things that will lead somebody to having a heart attack. Okay, so type 2 diabetes is one of the things that will cause you to experience a heart attack. It is the biggest risk factor. If you compare it even to the second risk factor, you have metabolic syndrome. And it's by far, diabetes is by far worse than you having a metabolic syndrome. Now, you may ask, what is metabolic syndrome? It's a situation where someone has high triglycerides, high blood pressure, and also has a large waist circumference, really, really high cholesterol too. Okay, the person is most likely obese as well. The person is struggling with insulin resistance. So what metabolic syndrome is that it's a loop. Okay, it's a loop. So most of the time when somebody is suffering from hypertension, they most likely have insulin resistance. Most of the time they are overweight, although not all cases. Okay, even if you're not obese, some of you are overweight, or you are dealing with abdominal obesity, you are dealing with pot belly. Okay, so it's a loop. That's what metabolic syndrome is. Okay, now we have the third cause of heart disease, which is hypertension. Okay, and like I say, dealing with hypertension, the first thing you have to note is finding out what caused your hypertension. okay? And then treat it from the root cause. So you have to know. You can't treat something that you do not know the cause of. You really have to sit down and ask yourself, look at your test results, look at your markers, and identify what the biggest cause of your hypertension is, and then work your way from there, okay? And then you have to try as much as possible to get off your medications too, okay? And we're going to talk about medications in a little while, okay? And the next marker that we have, if you are following my graph, is obesity. Okay, now it's not new to you. You know that you being overweight or you being obese is a problem, right? So obesity is one of those things that causes heart disease, as well as somebody developing or experiencing a heart attack. So what you have to do is to first off check your BMI, know if you are in your healthy weight range, and then build more muscle mass. I'm saying build more muscle mass, which means that you should exercise. Okay, building more muscle would help you not store fats. If you build enough muscle mass, then your body can store glucose in your muscles and you just use that for energy instead of your body storing your glucose as fats. Your body would now store it in your muscles and then enable you have enough energy to move around. Okay, but we don't build enough muscle mass. We don't eat enough protein, neither do we perform enough exercise. So build more muscle mass and get in shape. That would help you greatly with your obesity. Now, these four conditions, all these four conditions that we've discussed, high blood pressure, obesity, type 2 diabetes, and metabolic syndrome, all these four conditions can be fixed if human beings just ate the way they are supposed to eat, okay? And I've given you this blueprint before, but I'm going to give it to you again. What you need to eat as a human being is 50 to 100 grams of carbs every single day. You don't have to eat carbohydrates, but if you must, okay, carbohydrates is not mandatory. Your body can survive if you never eat another carbohydrate food again. We only feel like we would not survive without carbs because of our addiction to carbohydrates. Okay, so you eat 50 to 100 grams of carbs. Carbs are not your body's most preferred source of fuel. Okay, it's not. What is your body's most preferred source of energy and fuel to do the things that it needs to do is fats. Okay, so you have a limit of 100 grams of carbohydrates, okay, if you must eat carbs. And then you have your protein, you have your fats. You can eat as many as you like. And we say that you can eat as many as you like because if you eat enough protein and fats, then you would get full faster, okay? And then you have fasting. And then you have to cut off all manner of processed foods. Any food that comes in a package that you have that doesn't that's the ingredient list. If you look at the ingredient list, it passes 5 ingredients. That's a packaged food. That's a processed food. Okay. So cut off your processed foods, cut off hidden sources of sauce, like in your mayonnaise or in your ketchup, in your Maggi. All these things are hidden sources of salt, like in your bread, things that you would eat, and then they will tell you at the hospital that you should reduce your salt intake. The normal table salt that you use, there's nothing wrong with it. What is wrong is all these sources of hidden salt that you know nothing about. Okay, so cut all those things off, and then your sugar as well. Okay, so I have promised myself that I wouldn't ever sell another meal plan again. What you need is just a proper human blueprint, I would say, of how everybody should eat. And if you eat like that, you'll be able to beat any lifestyle disease. Okay, so what I have done in this book that you are seeing here on your right is to just list out the safest carbohydrates you can eat that would meet up to your 100 grams, the list of proteins, list of fats, list of oils and nuts, fruits, vegetables, how you should fast. I just put it there, and then I give you a table to prepare your own plan so that you won't tell me that you cannot stick to this or stick to that. Because I think one of the problems of meal plans is your inability to stick to what you are given. Okay, so you make your own plan. Every day you eat what you like as long as it is according to the list that I have given you. Okay, so when you do that, you would know that you would realize that you wouldn't turn out to be a diabetic patient or a hypertensive patient. And even if you are already, you begin to recover. Because like we discussed in our last live session, 80% of your progress, you reversing hypertension or diabetes, 80% of your progress comes from the way that you eat and the way that you do this list here. The way that you perform on this list, that is 80% of your progress. The other 20% will now come from things like your supplements or herbs or things like cardamom, okay? Or your medications. Those are just 20% of the work, okay? 20%, not even up to 20%, just 10 to 15%, okay? That is what it is. They are just boosters. Supplements are simply boosters, okay? Medications, they just help you with your symptoms, okay? But where your work really, really lies is in your eating pattern. Okay, so that's that for our book. The next thing that we see on our list is smoking. Okay, and if you compare smoking to type 2 diabetes, it's honestly not as bad as it is. Okay, but please don't smoke if you are smoking. Okay, and then we have family history. So we hear this all the time: family history, family history, family history. My parents are diabetic, my grandparents are diabetic. It runs in our family. You can see family history is just 1.5. You cannot do much about your genes, okay? And we know that these things actually, run in the family. But like I've told you, nothing is wrong with your genes per se. What you have running in your family is a gene expression. Okay? Not that hypertension or diabetes actually runs in your family or can be passed down from parent to child. What we have going on is an expression of diabetes or hypertension in your genes. Okay, and you can do something about it. Okay, you can surely change your gene expression. It's not stamped, it's not written in stone. Okay, you can change your gene expression by simply changing how you manage your life and teaching your children too how to eat properly. Start when they are young, not when somebody is older and then they already have children or they are already so grown and then they now get some medications and it's now, they are now trying to reverse it from there. Teach them while they are young. Teach your grandchildren while they are young so that they won't have to suffer or go through what many of us are going through right now. Okay, so any information that you learn, don't say, oh, they are too young, they are too young. I saw a diabetic patient who is just 25 years old. 25 years old. 25 years old is a diabetic patient. So start while your children or your grandchildren are young. Begin to educate them because some of them may not know. And that's how you were too when you were young. You couldn't care less about your health. Okay? You really couldn't care less. You thought maybe it's a disease for when you get older. But because of the way we eat and the way we pass it down, we no longer fast. There's a radical change in our eating pattern from the way human beings are supposed to eat, okay? Such that at 25, somebody's body is already overloaded with toxins, okay, and too much carbohydrates, and they're already hyperinsulinic, okay? So teach them while they are young. Begin to incorporate the things that you are learning slowly into their diet. If they are still at home with you, begin to incorporate it slowly, okay? All right. Now, let's move on to the next part of our graph, which is the blue zone, okay? The blue zone. Now, the first on the blue zone is lipoprotein, insulin resistance, okay? So many people are insulin resistant. So many people are suffering from hyperinsulinemia. And what that simply means is too much insulin being excreted into your body because of your high carbohydrates intake. So many of us are not diabetic, but many of us are hyperinsulinic. No doubt about it. Okay? So dealing with hyperinsulinemia is one of the things that would cause somebody to have a heart attack. So all these people that we see that, oh, they just had a heart attack out of nowhere. She was very healthy. She was very healthy. You are going to a pattern, all of a sudden, the person just slumps. or the person just has a heart attack out of nowhere, and you are wondering, what happened to this person now? You know, she's not on medication, she's doing just well. And the thing is, we don't even mark this hyperinsulinemia on our blood test. Do you know that? It doesn't show up in your blood test. It doesn't show up. Okay, so this is what is going on with somebody when they have just that sudden heart attack that is like, oh, you know, this person was really, really healthy. They were struggling with hyperinsulinemia. Okay, so even if you are not a diabetic patient yet, or it's not that I'm wishing diabetes on you, but even if you are just hypertensive or you are not diabetic, listen to advice that is given to diabetic patients, because diabetic patients are simply people who are dealing with chronic hyperinsulinemia. Okay, so even if something is not wrong with you, and this is why it's important that you get a proper eating habits guide, because if you eat like a proper human being, then you won't have to worry about turning into a diabetic patient, because it will not happen to you. Do you know how small 50 grams to 100 grams of carbohydrates is? And you are expected to not move past that marker every single day. If you eat like that, there is no way you'll be hyperinsulinic, except you are not doing something right, or you are not cutting down processed foods. That's the only way. Because the only reason your body releases insulin is because of too much glucose. Okay, so many people are living in a state of hyperinsulinemia. All right, now when your body releases that insulin, what insulin does is that it stores fats. Okay, because insulin will be looking for where to keep that glucose, and you don't have enough muscle mass. You don't have enough muscle mass because you're not exercising, you're not moving. So your body has to store it as a form of fats that we call triglycerides. And that is the next cause on our graph, okay, triglycerides. So that's how your body stores excess carbohydrates, okay, and it pushes them into places like your abdomen, okay, and that's how people develop a pot belly. It pushes them to places like around your liver, and that's how people end up with fatty liver disease. Okay, so all these things can be kept under control with a proper human diet. Okay, now we have LDL cholesterol, and even before we get to LDL, you can see something that we call apolipoprotein, and then you have non-HDL cholesterol before you now see LDL cholesterol. So apolipoproteins are proteins that your body attaches to lipoproteins to transport nutrients around your body. Okay, you may not really understand what I mean, but that's okay. You don't need to understand. Okay, but after that apolipoprotein, you see non-HDL cholesterol. Now, what does that mean? Non-HDL cholesterol includes other types of cholesterol that we don't pay attention to. I don't know if you've ever looked at your test results and see something like VLDL. VLDL, that is very low density lipoprotein. That's what it means. Okay, so non-HDL cholesterol would cause somebody to have a heart attack before you now have LDL. When I was giving during my cholesterol talk, I made you understand what LDL means and what HDL means. LDL simply means your liver is sending out cholesterol to parts of your body. HDL means that you are getting cholesterol back to your liver. Okay, these are simply buses. They are simply transportation mediums that your body uses. Not that LDL is bad or HDL is good. It's just how your body operates. Okay, I do not know where we got the misconception of LDL being bad and HDL being good for you. I honestly do not know. Okay, but LDL doesn't mean that something is bad or your cholesterol is bad. When you know that somebody's cholesterol is bad, it's what we call VLDL. You start looking at the size of the cholesterol. If the cholesterol is small, that's why we call it VLDL, very low density lipoprotein. VLDL, very low density lipoprotein. So it's very small. That's how you know that it has been attacked, that cholesterol has undergone oxidative stress and inflammation, because cholesterol is big and it's fluffy. Okay, so you would even look at VLDL before you now look at LDL cholesterol. Okay, so having type 2 diabetes, if we compare LDL cholesterol that everybody's always running away from, and my LDL is high, my LDL is high. Before you look at it, look at VLDL. Look at your triglycerides. Look at your insulin resistance. Okay? If you compare LDL cholesterol to diabetes, you can see the jump. It's 10 times higher. But they would never mention it to you that, oh, as a diabetic patient, you are at risk of having a heart attack. We rarely, rarely, rarely hear that. We rarely hear that. Okay? Before we start talking about LDL cholesterol, let's talk about hypertension. Let's talk about metabolic syndrome. We already know that, somebody being hypertensive can lead to the person having a heart attack or a stroke. And we did a very good job in the awareness of that. Okay? But before you start taking a look at your cholesterol, look at triglycerides. Triglycerides are far more important than your LDL cholesterol. Okay? And some people even go as far as looking at somebody's total cholesterol. That's not an appropriate way of checking somebody's risk for heart disease. You have to look at all the markers. Because if your LDL cholesterol is high, but you have a very small number of VLDL, you have a very small number of triglycerides, it means that you are very, very healthy. It means that you are very, very healthy. Okay? So this whole LDL saga is very, very inappropriate. And you getting on medications is not truly protecting you from having a heart attack because it doesn't solve the sole cause of your problem. Okay, your medications themselves, like I told you, it's just 10 to 15%. Where your work lies is in the 80%, which is how you eat, how you live your life, how you fast. Okay, your medications themselves, it really doesn't do much for you. And that's why you have to stay on them every single day. Okay, and even if you're on medications, it's not a guarantee. It's not a guarantee that you would never struggle with these things. Because even somebody that seems to be perfectly healthy, and they go for a party, they just slump and just have a heart attack, and it's like, well, this is coming out of nowhere. They are not on drugs. They are not diabetic. They are not hypertensive. Okay? All right. Now, let's talk about first aid when it comes to heart attacks. Okay? Now, some of the signs you would notice if a person is suffering from a heart attack is the person will start sweating profusely and their skin will start getting pale, like white. Okay, they'll start experiencing shortness of breath, like, it will be difficult for them to breathe. Okay, if you check their pulse, it would be weak and it will also be very fast. Okay, they will feel like throwing up and they will have very, very severe pain. And that pain will be radiating from their back to their neck, their jaw, their arm, and the left shoulder. So I put left in capital letters because I want you to take a look at. I want you to notice that I said left shoulder. So try to know where exactly the pain is radiating. So if it's in the left shoulder, okay, and it's really, really a severe pain. Now, when you notice all these signs, that's when you know that somebody is suffering from a heart attack. Okay. Now, before you call emergency number or before you try to get to the hospital, and even when you get to the hospital, before they even attend to you, okay, let us try and know some first aid practices that we can apply along the way that would help us save our lives and that of our loved ones. So if somebody is suffering from a heart attack or you are suffering from a heart attack, try to sit on the floor with knees bent. Okay? Try to sit on the floor with knees bent. It would be very helpful if you have someone around you. Okay? But if you do not have someone around you, I would let you know the first aid for that. Well, then you try to sit on the floor and try to bend your knees like this. Okay? So this person is sitting on the floor and the knees are bent, right? And then you can also try to rest on a solid like a chair. Okay, so the chair in your sitting room, right? Try and rest on it so your back will be supported as well as your head. Okay. The next thing you're going to do is call for help. Okay, because you do need help. And then you take 1 tab of aspirin and then you either chew it very slowly or you place it under your tongue. Now, aspirin is one of the things I think everybody should have at home. Okay, for moments like this when somebody is suffering from a heart attack, even though we don't pray for such, but it's one of the medications that is essential. okay, for emergency purposes. So aspirin, one tab, you either chew it or place it under the tongue. Now, if you are alone and there's nobody to help you, I would suggest that you try your best first off to get aspirin. Okay, if you have it somewhere around the house, try your best to get it and just place it under your tongue. Okay, and then the next thing you do is to call for help. Okay, so we have 112, which is our emergency number in Nigeria. Okay, or you call a friend or one of your family members that's living close by, or your neighbor, you know, whatever it is, try to call for help. And then the next thing you're going to do is to try as much as possible to cough really, really hard. You have to cough like your life depends on it. Okay, and it will be quite difficult for you because you are alone and, you know, it's a very, very severe pain, but you would have to cough like your life depends on it, the hardest you've ever coughed in your entire life. Okay, but the first thing I want you to do is to reach out for aspirin. Okay, that would help to open up your blood vessels a little bit. Okay, it will just help with the situation, and don't just swallow it with water. I know it's bitter, but try to chew it or just place it under your tongue and allow it to walk slowly, because when you do that, then you are breaking the molecules of the medication down, so it's easier for your body to absorb it and for it to start doing its work, other than for you to just swallow it with water. Okay, so if you are alone, we are kind of working backwards. So aspirin first, then you call for help, and then you have to cough as hard as possible. Okay, and then while you are coughing, also try to take note of your position as well. Okay, so this is the best position to be in. You sitting down with your knees bent and then supporting your back and your head with something, okay, like a chair. All right, okay. So with that, we are done with today's session. So let me know your questions. And if there are none, you are free to go, okay? So we are done. Comments, feedback, questions, anything you want me to know, please let me know now, okay? And if you don't have anything to say, you are free to go. I hope that this was very helpful to you, okay? Thank you for coming. Okay, signs of a heart attack. So we have someone sweating profusely. Okay, so serious sweats and a pale skin. Okay, so it seems as if the person is losing their skin color a little bit. They're looking pale. They're not looking as bright as they used to. Okay, and then you have shortness of breath. If you check the pulse, it's weak. It's a very weak pulse. Okay, and it's also very fast. They will feel like throwing up, and then you have severe pain that radiates, especially to the left shoulder. Okay, especially to the left shoulder. So that's your key to knowing if you are struggling with a heart attack or not. Okay. Any other question? There is no supplement or herbal remedy that would prevent you from having a heart attack. I do not know of, neither do I believe that there is any that would prevent you from suffering a heart attack. What you have to do to prevent suffering a heart attack is for you to look at these risk factors. Okay, to look at these risk factors I've talked about in this graph. So your insulin levels, type 2 diabetes, hypertension, obesity, smoking, looking at your triglycerides. Okay, those are the things that would determine if you are going to suffer a heart attack or not. There is no supplement that guarantees that if you take it, you would never suffer a heart attack. Neither is there any medication as well. Okay. Okay, so the lowest pulse rate that someone would have is when your heart is beating fewer than 60 beats per minute. Okay, that's the lowest pulse rates. Okay, and for maximum, it would be around 180 above 200 beats per minute, if I'm correct. Okay. Okay. But checking your pulse, I mean, if you are struggling with a heart attack or somebody is struggling with a heart attack, I don't expect you to get like a BP machine and you're trying to measure the person's pulse rate. You can just check with their wrists, okay, to try and feel if their pulse is weak. You know, there are certain things that all of us should know or that we should be educated about. And one of the things is checking someone's pulse. Okay, you can just check their pulse on their wrist or at their neck to see if they have a weak pulse. Try to listen carefully, and also try to know if the person's rate is beating really fast. Okay. And remember, it's not the only marker, because somebody can have a very rapid pulse for many reasons. Okay, or a weak pulse for many reasons. So try to look out for other markers as well. Okay, like severe chest pain and sweating profusely. Okay. All right. Does it mean that we can do away with carbohydrate completely? Yes, you would survive and you would flourish. You would do better than people that eat carbohydrates. Okay. But if you cannot do without carbohydrates, then just keep your carbs low. Okay. By keeping it to 50 to 100 grams per day, and then improving your protein and your fats. Okay. Can one take aspirin every day? I would not recommend that you do. Okay. Aspirin is you need to have your doctor's permission. You would need to have your doctor's permission to take aspirin. Okay. It's just something that can help when somebody is suffering from a heart attack. Okay. So it's a medication that should not be abused, please. Okay. It's an essential. You should have it at home. Okay. But I would recommend that you use it only when you are advised to do so by your doctor. But in the case of an emergency, aspirin can help. Okay. But it's not something I would recommend that you take every day, please. Okay. All right. Any other question? Any other question? Or comments or feedback? If one is already experiencing this on and off, heart attack on and off, is it a heart attack that you're experiencing or chest pain? Because they are quite different. We can mistake them. We can mistake one for the other, but it's not ideal to have a heart attack on and off, repeatedly. So I think what you may be struggling with is chest pain. If you have heart attacks on and off, you wouldn't survive this long. Okay. So you said some of the symptoms I've mentioned. Okay. So it's not it's not a heart attack that you're experiencing. If you are a hypertensive patient, you having chest pain, I want to say it's normal, but then having chest pain is not normal. But there is a time that chest pain would be considered an emergency and other times it wouldn't be considered an emergency. Okay, so there are times where you know that, you should have to get to the hospital. Like when the pain starts getting very severe, or you are losing your breath, or you start vomiting, okay, or you're feeling very nauseous. Okay, those are times that you would know that, okay, you have to call for help or you have to see a doctor. Okay. So chest pain is very common and it's not all the time that it's an emergency. Okay, and you can have chest pain repeatedly. Okay. I made a post on that a very, very long time ago. I think 2 to 3 years ago. It was one of the first posts I made when I started. So I would send that again so that you can go through it. But what is there is simply what I've explained. Okay. There are times that chest pain can be overlooked and other times it shouldn't be overlooked. Okay. And the timing too matters. Okay. So if your chest pain is lasting longer than 5 minutes, then it's something you should see your doctor about. Okay, if your chest pain lasts longer than 5 minutes, then it's something you should see your doctor about. Or when you try to rest and it doesn't go away, or even after taking medication, okay, that is prescribed, not over-the-counter medication. So let's say you've been to the hospital for chest pain multiple times and the doctor tells you, okay, take this particular medication to help. And after you take that medication, it doesn't help or it doesn't go away, you should see your doctor. Okay. So there are times that chest pain is an emergency and other times, you can overlook it. Okay. Okay. Mr. Steven, before now, I thought taking fat is bad. Okay. We all thought that too, including myself. It is what it is. It's just misinformation. But if you look deeper, and even some medical doctors too thought about or believe that fat was bad, and you should go low fat, and they too had a change. Okay. And they've written so many books that you can find online, which is what I read as well, that gives you evidence of how this myth started of somebody going low fat or cholesterol being bad for you or for your health. And they really put things into check. And sometimes some of the studies that we base these notions of fat is bad for you, most of these studies were not done right. So sometimes there will be just an observational study, or other times they would be done in animals, or they'll be done in just a specific country with very limited number of people. Okay. Or sometimes one big medication producer, or like a pharmacologist, or just a random big company that produces medication or wants you to get something would sponsor these studies. Okay. And when they sponsor these studies, you will know that the outcome definitely would be to lead you into getting some medications. Okay. So there is a lot of misinformation and also a lot of flaws in medicine as a whole. Okay. And it's one of the reasons that we are struggling today. And most times they honestly don't teach us these things in medical school. I'm in medical school right now. And most of the things that I know through research and listening to other doctors with so many years of clinical experience. That's how I get to know the things that I know, and I'm able to pass it on to you. Okay. They don't teach us these things in medical school. And I think it's that way because we are not supposed to see patients in the long term. It's your responsibility to take care of your health. Okay. So when you walk into a doctor's office, the questions we are asking is, what is wrong with you? When did this start? How can we relieve you of your pain? For things like lifestyle diseases like hypertension and diabetes, we are not supposed to see you long term, okay? So many doctors are overworked. So many doctors are overworked, and honestly, they don't have the time to start explaining these things to you, okay? So until I get there, I'm using my time now to explain things to you. And what I'm gathering, the information I'm gathering, like my dad tells me, it's going to be very helpful also for my future patients. So when somebody walks into my office, when I get my license, I already have so much knowledge. So instead of some medications being my first treatments for, let's say, a hypertensive patient, I know supplements that can help them. I know herbs that can help a patient. Okay. I can simply tell the person or just give the person a blueprint of, okay, this is what I want you to eat. These are things that are myths. These are things that are facts. These are things that you should overlook, you know? So I'm just gathering information, and until I get there, I'm sharing it with you. Okay. So there is a lot of misinformation, and by God's grace, we'll get through it, because today you hear that fat is bad. Tomorrow you hear that it's not bad. There has to be truth. There has to be truth somewhere. Okay. So I will do my best to let you know. Okay. All right. The cardamom, is it only to be taken for just that 3 weeks? No, you should use cardamom as long as you like. And like I explained in the last session, cardamom will simply help to bring down your blood pressure. It acts like a medication, like what your medications would do. The only thing with cardamom now is that you don't have the side effects that you would have with your medications. Okay, because cardamom is natural. So I said that 80% of your healing and your reversal would come from what you are doing with your health, your lifestyle practices. Cardamom is in the same table with medication, supplements, all these external things that you do. Okay. So if you really, really want to be done with hypertension, then you have to focus on the bulk, the 80%, okay, which is how you simply live your life. Okay, and hypertension is quite tricky because there are so many things that can cause someone to be a hypertensive patient. Okay, but most times it's hyperinsulinemia. Other things can cause someone to be hypertensive. Okay, some people, they just had a shock one day, and ever since then they've been hypertensive. Okay, for that specific individual, we cannot say that it's because the person has been living a poor lifestyle. Okay, so hypertension is quite tricky, and that's why I say you have to know the cause of your hypertension first, because so many things can cause someone to be hypertensive. Somebody can be dealing with liver disease or kidney disease or even ulcer, and it causes their blood pressure to go up. Hypertension or high blood pressure is a reflection of what is going on in your system. It's not like diabetes that, it's quite straightforward. If somebody is diabetic, you know exactly what the problem is. So first off, sit down, look at your markers, examine your life. When did this start? When I go to the hospital and I have a lipid profile test or a blood test, or I check my A1C, what is the cause of my hypertension? Is it my weight? Ask yourself these questions and then know the cause and start working from there. Okay? All right. Most Nigerian foods are carbohydrate based. Yes, they are. Honestly, foods that are not carbohydrate based in Nigeria will start moving into things like your protein and your fats, like your meats, your eggs, your chicken, butter, protein and fatty foods. That's what we'll start moving into. Okay. So I know that a lot of our foods are carbohydrates. But how you can tackle that is, first off, reducing your portions and then fasting. Okay. So reducing your portions and then fasting. So I'm not totally kicking off carbohydrates because I know that some of us actually cannot live without carbs. Okay. But you can't start from reducing your portions and then you fast. So let's assume you don't have breakfast. You extend that night fast. Okay. You extend that night fast to about, say, 12 p.m. Okay. And then your meal would be little carbs. Okay. Little carbohydrates with lots of protein. Okay. And then at your dinner time, you have a salad. Okay. That's a very, very simple way to eat every single day. A very, very simple way. And if you're ever hungry in between, you can have some teas, you can have some nuts, you can have some seeds, you can have some things like avocados. You can even boil egg and keep. You can even prepare a smoothie for yourself so that anytime you're hungry, you just chew on that. Okay, or you can boil meat and keep. Anytime you're hungry, you snack on that. Okay, so there are ways that you can work around it. Okay, except if you are dealing with diabetes, which is a carbohydrate problem, then I would say that you don't have to touch carbs, or you at least for a while. Okay, you have to give up carbs for your recovery. But if you are not yet diabetic, there are ways that you can eat carbohydrates and still you know maintain a healthy system. Okay. All right. You can message me for cardamom. However, my cardamom stock has run out, so I've ordered for more. So I would make deliveries next week. But you can message me for cardamom. Okay? Yes, I will definitely make the recording available for you. Okay? All right. Any other question? You're welcome, Mr. Steven. You're welcome. Any other question or comments or feedback that you want me to know? You're welcome, ma'am. Thank you for coming. So I hope that after today, we will stop being afraid of LDL cholesterol being high and causing heart attacks, right? So before we start talking of LDL, we'll have to first of all talk of VLDL, right? And then triglycerides. Then we'll have to talk about insulin resistance. We'll talk about obesity and that pot belly, hypertension and diabetes before we then talk of, oh, your LDL is high. So that's the takeaway from this session. Okay, if you look at the graph, you see that so many things come before LDL cholesterol that you have here. In fact, it's like the least you should even worry about. Your LDL cholesterol is part of the least you should worry about, because if you compare 1.38 to let's not even go far. If you compare 1.38 to 6.4, that's a very big jump. If you compare your LDL cholesterol to your insulin resistance, it's a big jump. Okay, so that's what I want you to take away from this session. The next time you go to the hospital and they tell you, your LDL is so high, you are going to suffer a heart attack, also look at other markers to really know if a heart attack is coming or not. Okay, All right. Any other question? And if there are none, you are free to go. Thank you for coming. Comments, feedback, questions, please let me know. And if there are none, you are free to go. Okay. Thank you for coming and attending live. Yes, there would always be a replay. Okay. So don't worry, ma'am. You'll get the replay at 8:30. Okay. All right. Any other question or comments? And if there are none, you are free to leave. Thank you for coming. Happy New Month to you too. Okay. So I would end the recording now. If there's anything, just let me know using the chat, or you text me privately, or call me, or you send me an email. All right. Take care, everyone. I wish you the best of health. Bye.